Hello everyone. I am grateful for all of your continued hard work as we manage this unprecedented pandemic. As I have previously stated, our proactive approach, including our expanded inmate testing capacity, will aid us in further combating the introduction and spread of the virus within our prisons. As a result of those efforts, we are starting to see positive results. Currently, while we have confirmed active cases at 48 of our 122 federal prisons and at 5 other locations, we have more inmates and staff who have recovered from COVID than are currently infected. In total, there are 1,577 federal inmates in Bureau facilities and residential reentry centers and 181 Bureau staff who have confirmed positive test results for COVID-19 nationwide. But we also have 3,180 inmates and 413 staff who have recovered. In response to the COVID-19 pandemic and the Attorney General's memoranda to BOP prioritizing placement of at-risk inmates in home confinement, we have worked diligently to place an additional 3,183 inmates on home confinement, an increase of 112% in 2 months. I want to comment briefly on a misconception you have been hearing about regarding our releases to home confinement. While there's been focus on a few high-profile cases, it is unwise for people to generalize the BOP's efforts based on a few examples. With over 6,000 inmates now in home confinement and over 1,100 pending community placement, the BOP has clearly moved with the urgency to implement the Attorney General's directive and is actively considering, on a case-by-case basis, all eligible offenders without regard to race or economic considerations. As you all know, inmates may be denied home confinement for a variety of reasons, including a violent offense, significant misconduct, the absence of a COVID risk factor, or the lack of a viable release plan. The BOP's infection and recovery rates, like those in the public, offer us an opportunity to begin determining our next phase of our response. As we begin to see various segments of our economy and society slowly begin to reopen across the country, we must be cautious as to our approach to ensure we do not introduce, or at certain sites, reintroduce the disease into our environment. We will continue to follow CDC guidance for correctional and detention facilities to inform our planning and adjust our response to COVID-19 accordingly. We will also work with our community partners to determine how additional testing can assist us in planning and mitigation. We all need to do our part in order to carry out our mission. I appreciate your continued dedication and commitment to keeping yourselves and your families, your fellow staff, the inmates, and the general public safe during this public health emergency. Each of you are corrections professionals, and I thank you for all that you do and for all that you have done. I am proud to serve the Bureau of Prisons and the country with each of you. We will get through this together. Together we are stronger. Together we will continue to make the difference. Thank you.